Asthma affects millions worldwide, marked by wheezing, shortness of breath, inflammation, and chest tightness, narrowing the airways and causing breathing difficulties. The prevalence of asthma is influenced by genetic, environmental, and often overlooked dietary factors. This video delves into the topic, discussing the optimal diet for asthma, highlighting foods that can alleviate symptoms and those to avoid. Stick around as we explore surprising insights. If you're ready, let's dive in. Alongside environmental factors, dietary choices significantly impact asthma prevalence. Since the mid-20th century, lifestyle changes and dietary decisions have contributed to the rise in this condition. Certain inflammatory foods worsen asthma symptoms, such as refined grains, overly sweetened desserts, and processed or red meats. People often prioritize convenient and fast food over ample servings of fruits, vegetables, and whole grains. However, it's essential to note that diet is not the sole factor influencing asthma. Other environmental factors like air pollution, tobacco smoke, living conditions, allergens, and exposure to occupational dust or chemicals also play a role. Nonetheless, diet remains crucial. Let's discuss how to choose the best diet for asthma symptoms. Scientists suggest two diets that may benefit those with asthma symptoms: the Mediterranean diet and a plant-based diet. First, the Mediterranean diet, renowned for its positive impact on heart health, includes fruits, vegetables, omega-3 fatty acids, and whole grains. It stands in contrast to high-fat, fast food dishes, focusing on locally harvested, minimally processed, and seasonally fresh foods. Next, a plant-based diet, low in saturated fat, emphasizes fruits, vegetables, legumes, and greens that reduce inflammation. Studies show that a vegan or vegetarian diet with high fiber levels improves lung function and gut microbiome, reducing the potential for aggravated airway diseases. Considering both diets, certain foods may help reduce asthma symptoms. Examples include apples, citrus fruits, leafy greens, tomatoes, beans, legumes, turmeric, ginger, salmon, and flax seeds. These foods contain vitamins, minerals, antioxidants, and anti-inflammatory properties. Now, let's shift focus to foods to avoid. Research on the increasing prevalence of asthma points to the Western diet, characterized by lower consumption of fruits, vegetables, legumes, and whole grains. Instead, there's an increased intake of animal products, saturated fats, and fewer servings of recommended fruits and vegetables. Common elements of the Western diet include processed and preserved foods, along with readily available fast food options. Examples of foods to avoid include fried food, sweets, refined grains, processed or red meats, and high-fat dairy products. These foods are often high in sugar, sodium, omega-6 fats, and saturated fats, with lower levels of antioxidants, fiber, and omega-3 fatty acids. Understanding these dietary practices helps explain the rise in asthma prevalence, indicating the need for public health interventions. Chronic inflammation caused by low fiber intake and higher bad fats can increase airway inflammation, negatively impacting lung function and leading to frequent asthmatic episodes. In conclusion, choosing an anti-inflammatory diet rich in fruits, vegetables, and whole grains while avoiding processed and high-fat foods can significantly benefit asthma management. Support the channel by liking and subscribing. Your respiratory system will thank you for making these dietary adjustments,